Welcome, everyone. We are here tonight to discuss we're going to address the COVID-19 vaccinations. And if there's any hesitancy, hopefully this will clear it up for you. If you speak Haitian Creole or Spanish, if you go down to the interpretation bar at the bottom of your screen, click on interpretation. If you click French, that will bring you to the Haitian Creole live interpretation. If you click Spanish, it will bring you to the Spanish live interpretation. Also, if you have any questions at any time, all you have to do is click on the Q&A button at the bottom of your screen. If you're using a phone, it may be in a different spot. But if you click on the Q&A button, type in your answer, and we are going to try to get all the answers, all the questions. We're going to try to get an answer to every question tonight. Thank you very much. And Lamont, or the mayor?
Thank you, Larry. We appreciate that. And thank you, everybody, for joining us this evening. We are very happy to be here and discuss the COVID-19 vaccine, what it means to you, and try to provide you with the information that you would need in order to make an informed decision. One of the purposes of this meeting is also to try to encourage the communities of color who are severely underrepresented in the vaccine administration. And they are also, as most people know, the most vulnerable population. So we want to provide information that hopefully will allay any concerns that you may have or help you make a decision as to whether or not you should get the vaccine. So tonight, I want to talk about, just briefly, as we've stated before, I have formed a vaccine task force with two purposes. One is to the logistical side of the task force is to make sure that we have the resources, the locations, the volunteers, the supplies, and other things necessary to administer as many vaccines as we possibly can. The other side of the task force is the communication side. That is the purpose. The purpose of that side is to, again, reach out to the public, let them know of vaccine availability, keep them advised as to their eligibility, and to also provide information that hopefully will let them make a determination as to whether or not the vaccine is right for them. So the task force has been working very closely with the City of Norwalk, Norwalk Public Schools, Norwalk Health Department, and they're doing a remarkable job. Tonight, we have some panel members who will be pretty much the stars of the show, if you will, tonight. We have Dr. Priscilla Agumang, an internal medicine specialist with Norwalk Hospital Nuvance Health, and Dr. Tiziana Irma, Chief Psychiatry Officer and Vice President of Behavioral Health and Community Health Care Center. Moderating tonight's discussion will be Lamont Daniels, who is my Chief of Community Services of the City of Norwalk, that oversees the health department and is responsible for the administration of the vaccine provided by the city. We'll also probably be able to tell you about other areas where people can reach out and find out about making an appointment to get the vaccine. As you know, people now 55 and older, and teachers and healthcare providers and first responders and essential workers are now eligible to get the vaccine. So this is moving rapidly, and we want to make sure that we give you timely information, updated information to help you get your vaccine as quickly as possible. So having said that, I'm going to turn it over to Lamont and let him start the process, start the meeting.
Awesome. Thank you, Mayor. And Mayor, really thank you for your leadership and your attention on this subject tonight. And good evening, Norwalk. Let me start by saying that more than ever, it's vital that we continue to have these conversations in order to provide accurate and reliable information to our friends, our family, our neighbors, and our community in how to keep themselves and their loved ones safe. Norwalk, the origins of vaccine hesitancy is diverse, and no one size fits all to address these concerns. But tonight, as the mayor say, our two stars tonight, we have assembled a panel this evening to address them. We have one goal, and that's one goal in mind. And tonight, our goal is to provide reliable information to help you fill in the gaps in understanding about the vaccine, to also promote the safety and the efficacy of the vaccine, and to explain why the vaccine is important in order for those viewing now, and you may be watching us later, to help you make the right choice for yourself. So I am joined by two amazing doctors. They're my new best friends tonight. But more importantly, they also represent two of our community partners, as the mayor said, Norwalk Hospital right here in the city and Community Health Center. So let's meet them. Dr. Agyeman, would you mind introducing yourself and tell us a little bit about you?
Hi, good evening, everyone. My name is Priscilla Agyeman, and I'm a primary care physician at Darien Primary Care here in Connecticut. I take care of adults ages 18 and older with various conditions from different backgrounds. And I hope that I can provide some knowledge tonight about COVID-19 vaccine and how people can get vaccinated to improve their health.
Thank you, and thank you again for joining us. Dr. Irma, would you please introduce yourself and tell us a little about yourself?
Sure, thank you. And thank you again for having me as well. So I'm Dr. Tishiana Irma. I am a psychiatrist by trade, so I'm a physician, but I specifically focus in on the mind. And I work at the Community Health Center, as was said. I've worked both in Norwalk and in Stanford, and have been doing so for the past 8 years with the Community Health Center. I'm also an assistant clinical professor at Yale University at the School of Medicine. And I treat the whole lifespan, but mostly focus in on adults and have some adolescents as well. And I'm here because I've been a little vocal about my own evolution in thinking about the vaccine.
Fantastic. So thank you both for being with us tonight on such a very important topic. So all around the country, and even right here in our own city, people are talking about the vaccine. Should I get it? Should I not get it? I'm not sure. So as the vaccine continues to roll out in our state, we also know our Norwalkers have a lot of questions. And I want to remind you, if you have any questions, please put them in the Q&A section. We'll work to get to all of them as best as we can. But Dr. Agyeman, let's start with the basics. Tell us about the science of the vaccine. What should we know?
Yeah, so there are 3 approved vaccines. They've all been shown to be effective and safe. So all of these vaccines have undergone rigorous studies with over 40,000 people showing that they are both safe and effective at preventing severe illnesses from COVID-19, as well as spreading the infection.
Great. Anything you want to add to that, Dr. Irma?
Yeah, I think the one thing I would just add is sort of an emphasis on the fact that with all of these vaccines, all 3 of the approved vaccines, that no one who has gotten the vaccine has ended up having to be hospitalized with COVID or have died having COVID. So I just think that that's, you know, because now people are talking a lot about the newest one that's come out with Johnson & Johnson.
Well, we're going to talk about that.
So I wanted to, like, you know, as many times as we can say that, emphasize that.
And you kind of hit that too, Dr. Irma and Dr. Agyeman. We're just going to have a conversation and I'll start adding the questions from the public. So help our viewers understand, is it safe? We hear a lot of people say, but it took so fast, you know, how can they speed this up? And, you know, that they cut corners? And then can you talk about the ethical concerns that we're hearing a lot? So Dr. Irma, why don't you start, and then Dr. Agyeman, you can add to it.
Yeah, I think I would sort of start with just that concern about, oh my goodness, how fast this was. So one of the things that maybe sometimes people don't recognize is that this didn't all just pop up. This work has been done before, looking at other, like for instance, mRNA. I think that's really what sort of really caused the spike in concern. Oh, what is that? What is what is messenger RNA? That sounds too close to DNA. Like, are they going to be, altering me, right? And so I think one of the key points is the fact that in other types of viruses like Ebola virus, flu, even things that are not viruses and vaccines. So in cancer research, this research around messenger RNA has been done actually for quite some time. So because all of this work has been done already in the background, that really allowed, because of the fact that this is just so widespread, it was just so important, killing so many people, that people could really gather together and say, okay, let's shore up, let's share information, let's make sure that we get out there and get a vaccine for folks that's going to be really effective and safe. So the cutting of corners, I think oftentimes, unfortunately, we have a lot of bureaucracy and a lot less sharing that goes on because people are sort of in competition, but recognizing that the demand was just going to be so great, everybody was going to be able to get a part, get in on this. I think people really, scientists really work together so that this could happen a lot faster. I'll be quiet. I could say more, but I'm
What do you have to say, Dr. Argument?
Yeah, if I could just add that, like Dr. Arma said, the research and the science behind it has been there before. And so what they did was we needed this quickly to end this pandemic. But the same process, the same scientific process that we use to verify medications or any vaccines was done. Clinical trials with patients, looking at safety and efficacy was done the same way we would do for any other vaccine.
Let's get to, one of the main things that we've been hearing. And that question is, what do we know as to why people are hesitant to get in the COVID-19 vaccine? And what do you think we can do collectively? So let's unpack that. Let's talk about, let's just put it right there. We know we've been hearing it both locally, state, and in the country about the hesitancy or the concerns people of color have had around vaccination. So let's just unpack that. Can you speak to that? Because there are many people who are watching that are identifying that I'm just nervous about getting the vaccine. What do you have to say to those individuals who are very concerned about being a person of color and recognizing that historically, many years ago, which hasn't been that long, that there's been some unfair treatment? Go for it, Dr. Irma.
Okay, all right. Okay, so, I personally have a great number of patients who were very, very worried about the vaccine. And so, I had to do a little self-reflection on myself to say, hey, why haven't I jumped in the front of the line to get the vaccine myself? I have had both my vaccines at this point, very happy about it. But, being an African-American, born and raised in this country, I think there's so many layers here, right? So there's the layers of what has my own personal experience been with the medical field, right? As a patient, from the other side, from youth till, just having had 2 children and been behind the, in the operating room and not be the one who's doing the operating, right? So what has been my own experience? But then also, in addition to that, what have I seen? What have I also even seen as a healthcare provider over the course of the years, over the course of training, right? In terms of what the treatment has been towards Black folks. And then there's that extra layer, that historical layer, which I think sometimes, we know some information, and then oftentimes maybe we don't even know all of the information. A lot of people are talking about Tuskegee, but that didn't happen that long ago, but there are other examples of things that have happened just as far, not that far back, 1970s, right? Various things that have happened that have just been completely unjust. And I won't get into them. We could talk about that on another day because we don't need to add to it. But that's the history, right? That's the background. There's validity, okay, in having some degree of caution, right, with the medical field. So I think that part of it is what we know, but part of it is just like a sense, a feeling. Some of it is what's been passed on that we've heard that we should be hesitant because things have happened. And so I think that's almost ingrained in our DNA. And it's in part what I say is self-preservation, right? You've got to be cautious if you look at the past, if you're not looking at your past, you can repeat the same mistakes. So you have to kind of know something about what's happened, but then you need to use your information about what's happening here and now today. But I think that those are a couple of the layers of what's going on behind the hesitancy in our community.
Yeah, and I would say, in addition to the historical piece, there's a lot of examples that I'm taking from patients. So I don't go outside, I'm always inside. Do I still need to get the vaccine? Or, I've already had COVID. Do I need the vaccine? So those are things that are causing people to be hesitant. And I answer those questions by saying, yes, you can be reinfected with COVID. It's possible. The vaccine does offer a stronger as well as a longer protection against COVID-19 as well. And then lastly, for communities of color, we know that Black people are 3 times more likely to be hospitalized from COVID, and also, over 1.5 times more likely to die from COVID. So in this population in particular, even more reasons to really get the vaccine.
Great. So help me. So what do we say to people, to Dr. Irma, I think you illustrated very nicely. So let's get to, some I don't even know if the word solution is the right word, but what do we then say that, it's in my DNA, there's this historical piece, I've heard the stories. What do we say to someone who's, let's say, I can identify with everything you said. How can we help them go to the next stage to say, I'm ready to get it? What would you say?
You're using my lingo. So right, it's about stages of change. And I think that Dr. Ajimang actually started to point that out, right? So part of it is actually about information. So it depends on where someone is. If someone's just sort of like, I'm not sure about it, I don't know much about it. The first step is just the information, right? So people need the information and not everyone has access to it. Unfortunately, they're getting bits and pieces of partial truth, partial, made up rumor that's like the game of telephone. You remember that game? So somebody said something, oh yes, and all of a sudden that one thing that was, oh, somebody had a sore arm, now, oh yes, my uncle, so-and-so's uncle died after they got it. No, they didn't, but that's the case. So first is really the information. And the other piece is really just, having that empathy and not talking down to anyone. If you know someone in your family or your friend group or your colleague that is, not yet understanding whether they should get the vaccine, you don't want to talk down to people. You don't want to dismiss them. You really want to be curious. You really want to ask the questions. What are you still hesitant about? What is still keeping you from going to get that vaccine? Because that's going to lead to a really constructive conversation. And then again, people are along different points of that stage of change. So what I would also say is that you don't want to be arguing with anyone. If someone is just absolutely adamant against it, one of the things you can do is to model for them, right? So you go get your vaccine. You go get yourself safe and have the conversation and let them see you afterward alive and well, right? I had a patient who I vaccinated last Friday who said, she's not my patient already. I was just seeing her for the vaccination. And as she drove up, she said, I was going to cancel my appointment because I still think they're trying to kill us. And I said, I'm so happy you're here. And she said, you know what? As I saw you, before I saw you, I was about to pull off and just like, I'm not doing this. But I had, what she told me? She said she had nieces and nephews who talked to her and said, Auntie, please go get your vaccine. So all these people along the way made a difference so that she got that vaccine and she's good, right? And I can't wait. I hope I get to see her for her second dose.
That's amazing. I think what I like what you're saying too is is that those that have received their vaccine, tell people, tell your network, tell your family and friends. It's not a secret. Share, because the more people say, oh, okay, they're still here. So let's shift to some technical stuff about COVID, because and I'll start with you with this layer of questions, Dr. Agyeman, around and Dr. Irma. This is a good conversation. Kind of already pointed out, I already have COVID, so I don't need to get the vaccine. And then I'm going to add another. I like to sometimes layer the questions and let you kind of unpack it. The other one we hear, to almost to the point of Dr. Irma, is help us understand, well, I don't go out, I've never taken the flu shot, and I never had the flu, so I don't need to take the COVID. Can you talk to us about that and talk to someone who's listening who has that belief? Because we are saying you need to get the vaccine. What do you have to say about that?
So like I had mentioned before, you can still get reinfected. Also, like we said, if you have gotten COVID before, you can get it again. And the immunity that you develop during that infection may not last as long. So who knows? We don't know. And it is 3 months, 6 months when you could be at risk for getting COVID again. So it's not just about you as the individual. This is a global pandemic. You have to think about your family, your friends, your loved ones, and your ability to potentially spread that to them. So that's why we're really strongly recommending that people get vaccinated.
Dr. Irma, you want to add anything to that?
I think that hit it on the nail.
So we have Moderna, Pfizer, and Johnson & Johnson just got approved, and it's in our state. Why is that one shot? Why is the other one 2 shots? What they trying to do now? Help us understand all of this.
Yeah, so the science is a little bit complex, but simply put, the Pfizer and the Moderna vaccines are mRNA vaccines, like Dr. Irma had mentioned. So what that means is that we're not giving you any COVID, we're not giving you the actual virus, but we're giving you mRNA so that your own body can produce a protein called a spike protein that when your body's introduced or exposed to COVID-19, it will know how to attack it and protect you. Now, the new Johnson & Johnson vaccine works a little bit differently. It uses an adenovirus. So an adenovirus is a virus that causes like cold-like symptoms, flu-like symptoms, pink eye, things like that. And it uses DNA, not your own, but from the COVID virus to tell your body to make that same spike protein. So essentially, the end result is the same. You're getting protection and your body's learning how to recognize the COVID-19 vaccine. The reason it's 1 dose, that's going to be a benefit in many ways, easier access because it only has to be refrigerated and not frozen or at a colder temperature like the other ones. So we're hoping that that will allow us to have more access to give to more people.
Can you speak to, because I've heard this a lot too, we were actually today was joined with Mayor Rilling through the health department, partner with the CHC to vaccinate the teachers. And it kind of goes on to what you were saying, Dr. Irma, that whole telephone, you know, because you're hearing the 1 shot with Moderna, Pfizer is fine, but it's that 2nd shot. And if you have people like me, I'm very animated, I'm very charismatic. I'm going to say, oh my God, that 2nd shot, my arm is going to fall off. I really don't mean that. And I don't want to make light of it. But for some people, if they hear it, they're going to take that really serious, although I may be joking, and that may be the deciding factor that they may not get it. But can you talk about why is it that we're hearing, and just something you could dispel, that the 2nd shot is worse? What is that about?
So I can jump in here. I mean, the reality is that for the people who have a reaction, those who do have a reaction may have much more of a reaction for the 2nd dose. So for the 1st dose, I'll just use myself as an example. For my 1st dose, I had a little bit of pain at the site of the injection. And I also had some heaviness and just like general soreness. It felt like I had like lifted a ton of weights with my 1 arm, which I should not do after not exercising for this many months. So that's what that felt like. But then the 2nd dose that I got, I felt fatigue. I was a bit down for the count. I had scheduled it so that it could be a Friday so that I could get through that on Saturday. So I would say initially that same night, I was good except for that pain. But then the next day, I really definitely felt, I felt fatigued. And then I also had a little bit of a fever, really, really low, you know, just getting to the point of a fever. And I was able, after a while, at first I kind of was trying to tough it out. So I didn't take anything for it. But then later on, I took a little bit of Tylenol and I had a headache. And so that's what people have largely said. That is largely what people have experienced for both of the vaccines.
Lamont,
Yes, sir.
one of the things that was just mentioned, I think by both doctors a few moments ago, it's so important to state over and over again with a serious degree of certainty that when the vaccine is injected, you are not being injected with the COVID virus. And I think because when the flu vaccine is out, there's usually a strain of flu that is included in the injection. And I think a lot of people hearing about COVID and the injections are so concerned that they're being injected with COVID. And I think that's one of the things we have to constantly stress over and over and over again so people understand that.
Yeah, do you all want to just add to that?
Do you want to?
I do want to reiterate that, yes, you cannot get COVID-19 from getting the vaccination. It is not a live vaccine like the flu vaccine. We kind of already went through how it works, but most importantly, like we said, with any vaccination that has certain materials from a live virus, you could get side effects. And I just want to go over the common side effects that Dr. Irma had already mentioned would be mild fever, headache, tiredness, and most of these resolve without treatment. But again, these are all very mild compared to what you can get with actually getting COVID-19.
That's so key. You know, in comparison, having had so many patients who had COVID-19, just nothing, you know, people with months of headache and dizziness and mental fog. I mean, the list goes on, but I think one of the pieces to sort of help people to understand it is it's more about your body, sort of, it's your immune system that is sort of saying, hey, you know, this is here, we're going to protect you against this. So it shouldn't make people more afraid that they would have those symptoms, feel like that after the second dose. It's really more of your body responding. So it can kind of make you feel like, hey, I know this is doing its job. Not to say that the folks who don't have those feelings aren't also building up an immune response, but it's not a bad sign.
So great. So I have a question around people with, you know, diabetes, hypertension. Are there any special precautions that they should take in regards to getting the vaccine?
Yeah, so many of my patients have a variety of conditions, and there are a list of high-risk conditions. Diabetes is one of them. High blood pressure or hypertension in itself is not one of them, but any heart condition, including coronary artery disease, heart failure, lung problems like COPD, asthma, all these people can get very, very sick if they get COVID-19, so they are considered high risk. And so all of these people should definitely be getting vaccinated, including the general population.
Yeah, I was just going to say, you know, in addition to getting very, very sick, these are also the people who die from it. So, you know, it is just that serious.
So we see Dr. Fauci, he's actually become like the spokesperson now under the new administration. And we keep hearing him say, we have to get to herd immunity. So can you help us understand exactly what that means? And then couple it with folks are saying, well, I'll just wait for herd immunity. What does that mean? And help kind of explain that to folks. Either of you can take it.
Herd immunity means, the way to think about it pretty much is that if a large amount of the population, a large enough amount of people get vaccinated and are protected from the COVID-19 virus, then you by way of that are immune, even if you don't get vaccinated. The problem here is that scientists still really don't know what that number is. How many people need to be vaccinated to reach herd immunity? And secondly, it's not a direct way to protect yourself. The only way you can know that you as an individual are protected is that if you get vaccinated. We can't depend on everyone else, not having COVID or being vaccinated. So again, that's sort of what herd immunity means. It is good. It's something that we're reaching for, but as an individual, to protect your health, your family, you need to get vaccinated.
We have a question around the variants. So definitely, can you explain that? But then the question is, because of this variant, and again, people are hearing this on the news, will we get a booster shot? Will we have to get a vaccine every year? Because this is what people are reading in the news.
So
Anyone can take it.
yeah. So there are a number of different variants. So there is a UK variant called B117, which is actually been sort of more widely found in the United States. And it's also included, Connecticut's also included in that. There's another one, is the South African variant, there's a Brazilian variant. And so one of the things that they've definitely found is that it can spread more, so more infectious. Differing reports and still trying to continue to dig into, might there be more severity, but thus far, nothing really strong on that front. But I think this sort of links to the last question where you asked about herd immunity, where we each have to be going out and getting our vaccine, because the longer and longer this virus is out there rampant, going from person to person to person, the more opportunities the virus has to try and say, oh wait, how do I stick around? How do I stick around? How do I mutate more so that people won't be able to be protected from me, right? And so we really have to each do our personal part so that we don't end up in a worse situation than we are already. So more to come. They're still studying and looking at the mutations to date, but unfortunately, the longer this happens, the more variants that are possible.
Dr. Agnew, you want to add anything to that? What about the booster shot?
I agree with everything Dr. Irma said, and that's great information. The only thing small thing I want to add is just that the Johnson & Johnson vaccine that just came out has been shown to protect against the Brazilian and the South African strains, as well as the one that's here. But again, this virus continues to mutate. There'll probably be some more variants coming out in the next couple of months if we don't get on top of it.
And one other thing just to add to that is this also shows how advanced we've become, because they're checking and looking for this in a way that they really probably haven't been as vigilant about in the past. So the more they're checking and figuring it out, they're finding these variants, and that's important, right? So that we can sort of be on top of it. And so I just sort of want to say that this is not surprising that there are these variants, because this has been around now. It's a new virus and it's been around without anything to protect us from it previously. So this is what is expected. And that's why we need to all go out and get vaccinated.
One other thing, Lamond, and I know we talked about this earlier today when we were at Brian McMahon, and this has been stated by Dr. Fauci and others over and over again, but some things are worth repeating. And that is, even if you get both vaccines, you should continue to do the kinds of things that we know work. Continue to wear your mask when you're in groups. Continue that social distancing. Continue washing your hands frequently. So I don't want people to feel all of a sudden I've gotten the vaccine, so I'm good. I don't need to worry anymore. So I think that's one of the things that we need to touch on as well.
Well said, Mayor. And there's some questions coming around this, because the study keeps saying, and you all can speak to this more than I can, how long, or what is the trajectory, or what is the research saying around once I get the vaccine shots, how long, or is there a time frame that it protects me? Can you get COVID again after I get the shot?
Yes, so as I had mentioned before, it's possible to get COVID again after you've received, not after you've received the shot, but if you've already had it. We know that the vaccines are 94% effective, the Pfizer and the Moderna. The Johnson & Johnson is 85% effective. So again, like Dr. Irma was saying, time will tell. We're hoping that it lasts for a very long time, but again, we will have to watch and see what happens. And so with anything that's new, we just have to look and keep adjusting as things change.
And, you know, I realized that we didn't answer because this is also connected, the booster question, right? So we don't know at this point. And one of the reasons why we know about Johnson & Johnson's effectiveness around some of these variants, or the variants, is because the trials were going on when these variants came up. So we don't have all the information, and there have been some studies they are looking at, even for the Pfizer and the Moderna. It does look like, at least for the UK variant, that it does neutralize, the antibodies do neutralize the virus. And, so again, a lot more work continues to need to be done. And so we sort of need to definitely get ahead of the game. If it's possible that we may need to do those things, down the line, we may find out that we don't. So we just sort of have to stay informed. And that was the one other thing that I thought we should, when you asked about educating people, recognizing that we really not only need to not spread things that aren't true, but we need to look to really credible sources. And so I always tell patients, if it says .gov at the end, .gov, that's a more credible source, right? As opposed to, the information from the information of somebody on Facebook. And then the CDC website is really, they have videos, they have, explanations that really, they have the stuff for the health professionals, but they also have things for everyone else. And I think that, people need to educate themselves, because it's not all going to be answered all at once.
You raise a good point. I want to hear your thoughts on it. It goes back to this hesitancy. And I don't know the proper terms, so I'm not a doctor, but can you just speak to, I'm trying to figure out the best way to say it. The CDC approved the vaccines, but then at the same time, we're also saying time will tell. It sounds like a contradiction. I don't know if I'm making sense, because CDC said it's good to be injected, but when the public raise these questions, time will tell. We don't know that yet. How do we reconcile it? Because I think that's what the issue is. I don't think it's about the actual vaccine. It's that when we ask the questions, we don't know that yet, but we know it's still safe to take it. Can you unpack that? You know what I mean?
So can I say one thing before that, right? So
take it. You're the doctor. You're the expert.
So the first part is that, yes, there is this time will tell and questions that we still have. But we also have questions about the virus itself. And we have even more answers about how dangerous it is, right? So we're always doing a risk and benefit. We're looking at what are the risks, what are the benefits? And if the benefits far outweigh the risks, we've got to go for it. And so what has happened is that, yes, as we spoke about, there are these phases of trials, all of which have gone, from phase 1, 2, and 3, where they're doing all these studies, looking at safety, looking at efficacy, et cetera. So all of that happened. And then you get into this other place, which we call phase 4, where widely everybody's out there, they're getting that medication, it's usually, or, a vaccine. And then you're looking to see, is there anything more? You have to understand, as Dr. Agyemang explained, there were so many people who were actually studied, right? Not only so many people who studied, it was much more diverse than they usually are, these studies. And so you had representative samples, right? That we have to then say, okay, now when we look at everybody, because all these people are going to go out there and get this, is there something that we'll see? Is there something new? And that's always what happens. And in this particular case, instead of it going through and just, okay, so we're going to do this FDA approval, it was an EAU, or an emergency use authorization that happened. So that's where you say, oh my goodness, there's no other alternative. There's no better alternative. Is this thing safe? And is this going to save lives? And that's what caused them to say, okay, go out there, vaccinate widely.
Well said, well said.
And yeah, I think that controversy of it's safe, it's efficacious, but we don't know everything is a good thing. Like Dr. Irma said, we needed to save lives, so that's what we're doing. We know that it's safe, and we're going to keep monitoring and keep watching to make sure that it continues to be safe and continues to be effective. And that's what we should be doing as medical, professionals and as scientists, to make sure that we're giving people things that we know will continue to be safe down the line.
Lamond, I see a question that, as I'm looking at it, it may be more prevalent out in the community than we realize. It's asking about if I have registered to get the vaccine, is there now a vial or a dose with my name on it? I think that may be a misconception also, thinking that, okay, my name is on this and maybe I'm getting something else, or the person who's asking this saying, I don't want to be a target. So when a person registers, their name is not on the vial. They go and they get whatever's there.
Right. Can you all speak to that in terms of the registration process? Is just to give us a count of how many vials we need to register the public? Can you all speak to that?
Yeah, sure. So no, there's definitely not a name connected to a vial. What we do, that information helps the particular center or clinic, vaccine clinic, to know how many vials they can prepare for that day, because this is it's very precious, right? There's a certain number of doses in every vial. So we have to really be strategic and make sure that we're not wasting any of the vaccine. So it depends on where you go. So certain places get certain types of vaccines. So if you go to one site, they may always get Pfizer, and that's it, right? So if you're scheduled for that particular place, all of the shipments that they get are Pfizer. Another, especially for instance, like mass vaccination sites may get a particular one. Ones that are in clinics will get a particular one. Hospitals have some variety. And so one thing that I did hear the governor say in one of his addresses was that they're going to now make it visible what is the type of vaccine that's available at the particular vaccine clinic that they're going to. And that would be newer, a new development.
There's a question around children. When would children get vaccinated? And you all could speak to that or have an idea of what you're hearing in the field.
I'm sorry, can you repeat the question? I didn't hear you.
Children, what are the studies? Have studies been on children, and what is CDC saying about children getting vaccinated? Is that going to be happening anytime soon?
So I think it's pretty common knowledge that children get a milder version of the infection. Most of the time, they don't get the severe disease or die from the COVID-19 like the adults do. So far, we know that the Pfizer can be used in people, I believe, 18 and older, as well as the Johnson & Johnson, and the Moderna is 16 and older. So those teenagers can start to be vaccinated. But again, more information is coming out.
And there are studies that are happening, so trials right now, where they are enrolling younger children as well. So we'll hear more when we know more on that front.
And there's a question around, kind of connected to the question the mayor shared with us around using what we call the VAM system, or have to put your information. One thing we didn't talk about was our undocumented population. what do you know about, I'm putting my information in, what is the government going to do with this? Are they going to track me? Are they going to follow me? Can you speak to those concerns that are really valid for communities? Anyone can speak to that?
We were all being polite, and I started the last one, so I was like, so yeah, I mean, it's tough. This is honestly, these types of questions, the one that Mayor Rilling talked about from the chat, as well as this, is really the reason why I went and got my vaccine, because in reality, I sort of made all those excuses. Oh, I'm at home. I don't have to see anyone. I don't have to do anything. But that was why modeling was just so important for me, because it breaks my heart, right? To hear people say those things like, oh my goodness, they'll use a different vaccine for me, or worries that, how else will my information be used? As someone who goes and vaccinates just 1 day a week, every week, I'm not using that information in any way, except to say this person got their vaccine. That's it. And we're not checking a bunch of various things. We're not doing any of that. It's just, name and date of birth. It's as simple as that. And obviously I don't work for the government, so I will leave the rest of that answer to you all, very knowledgeable folks.
Dr. Adjman, do you want to add anything, or?
Yeah, I agree. And to support the science that we talked about earlier, right? So how do we track if people had side effects and all these things? So these systems do help us, backtrack and see how many people are being vaccinated in what area, also any potential side effects down the line, because people do have side effects sometimes, and it may take some time. So I think some of that information is helpful, but it is a great question about, what's happening with the information. But like Dr. Irma said, to our knowledge, it's being used for the purposes of, getting the vaccines to the public.
We kind of talked about this earlier on, but people are logging in at different times. And so, and to the mayor's point, sometimes it's good to hear it over. So it's a variation of a different question that we kind of already talked about, but just wanted to see if you all want to add more to it. And the question is, the numbers in Connecticut are going down. I don't go out, so I should be safe. Am I right? Is the question.
Are you really not ever going out? That's the first of all question, right?
I can't answer.
Really not going out. And is there really no contact with absolutely no contact whatsoever? And the day that you need to be in contact, right? Now you're not protected. But I'll let Dr. Ajman say more.
So like Dr. Irma was saying, at some point, we're hoping some point soon, the world will return to normalcy. And so you will have to go out at the very least. I hope you go out to see your doctor, come see us, to make sure that you're healthy. And so at that point, you do need to be vaccinated, because you will be in contact with anyone who could be potentially exposed to COVID-19. So that's not a reason to not get vaccinated.
Question. With COVID-19, many underestimate their risk. It kind of speaks to their being exposed. What do you say to those that have said, I just don't want to get it?
I asked them, could you give me some more detail about why? Just, the why, right? Is it that, well, I'm healthy, and then I say, or hey, I got it and it wasn't too bad. Then I start to explain some of the other pieces, right? So that there are some people who have a very mild experience of it, but who still may have long-term problems that they couldn't have imagined, right? So they may have, end up later down the line having difficulty with breathing or swallowing, or have cardiac problems or kidney problems, or, any manner of things that didn't really creep up, didn't really show itself initially, but it speaks to that question of, well, there's so much we don't know about the vaccine, but there's so much we don't know about COVID and so much that we already do.
I know that every day, the mayor and I received a report from the health director, and we also know the deaths that are even in our own city, and it's just heart-wrenching that another person died today of COVID, another person died today of COVID, and so I'm just so overwhelmed with this discussion. Mayor, you want to ask a question or follow up to something?
No, I just got a question that was handed to me. How does the vaccine work in people with compromised immunity already, as such as a person who might have vasculitis and takes an immunosuppressive drug? What are your recommendations, or what do you think? What's the issue with that?
Yeah, so we touched on this a little bit earlier. So people who are immunocompromised, or in other words, high risk, some of those diseases we mentioned before, or taking medications that would reduce your immune system, suppress it, are at risk for getting very sick and also dying, that we had talked about before. So it's very important that you talk to your doctor or your medical provider about, do you need to come off of some of these immunosuppressive medications before you get vaccinated? When to get vaccinated, what time frame between that? So it's important that you really get that information prior to getting vaccinated. But we do know, and we still do recommend, that these people get vaccinated.
Yeah, we check that. So we have a series of questions that we ask. There's a series of questions that you answer. And then even when you come to be vaccinated, we will ask that. That's on the back sheet of the questionnaire. And we ask about, immunosuppression, if there is a bleeding disorder. And many people have it checked off yes. And then I ask them, have you had a conversation with your doctors? And they say yes. And they said, go and get your vaccine. Or they said, I'm going to take you off of this medication for a little bit, and then I want you to go and get the vaccine at this point. So many, many people are getting it, and actually had several people at this point they're on their second vaccine at this point. And they said, I did well.
Yeah, thank you. The mayor mentioned, to those that are listening, there are many ways to get vaccinated in the city of Norwalk, and it's really at this point a supply and demand. If you're watching the news, you'll hear, Connecticut gets a certain amount, and it has to be dispersed across the state. And so, like many other communities, the allotment that we receive, in one way, we see it as a good thing that people are getting it. And so you may end up being on that waiting list, or you may have to wait 2 to 3 weeks, 4 weeks out. But what I would say to everyone is just be patient. If you look on the state's website, Connecticut Department of Public Health, and you have the wherewithal and the resources to use the VAM system, and you fall in that particular phase, we encourage you to register yourself and then follow the prompts. We also encourage you to look at norwalkct.org, which is the city's website. We do list our sites when they're opening. We also list our community sites. Norwalk Hospital is one, CHC is one, and we also know our retail partners are CVS and Walmart, but they're done independently. We don't manage them, so you would have to go on their particular websites, because presently each entity manages their own vaccine clinic. It's not this one system. So to Norwalkers that are viewing, there are options. And at this point, you can call us or watch our website, and we can at least give you information, but you would have to enroll separately with those particular entities. We are getting ready to wind down, and I want to close with this before I turn it over to the mayor. I know it's almost 8 o'clock already. We move fast. But I just want to leave, hear from you all kind of your thoughts around going back to what we were talking kind of, before we went live, is around, excuse me, talking to individuals that are on the fence right now. I sort of kind of want to do it. I sort of kind of don't. I don't know. What's the message to them? And then even what's the message to those who are saying, I'm not ready yet? What would you offer to those that are on the fence? And those, I think you said it, Dr. Irma, in phases, they're not there yet. And that's okay. It's no shame, but we are encouraging people to get the right information because it's important to be vaccinated. So what would you say to, what's your message as we turn it back over to the mayor? What's your message? What's your message?
Well, I'll just say this, and I said some of this before, but I think it serves us to say it again. Get informed. Get the information. If you have questions, get it from credible sources, whether it's the CDC, your doctor, your pastor, right? So the people that you really trust who are out there and who really care about your well-being. Don't base your opinions based on people who have gotten their information from various places, because you just can't rely on that. It's your life that's on the line.
And I just want to add that COVID-19 doesn't care what color you are. So talking to our communities of color, it's important, very important that we get vaccinated, not only to protect yourself, your family, your friends, but also to support this end to this global pandemic that we're having so that we can all return to normalcy one day.
Thank you so much. I'll turn it back over to the Honorable Mayor Harry Rilling.
Thank you, Lamont. Just quickly, I just got one more question. If someone has gotten their second dose, should they wait 2 weeks or more to get a shingles vaccine?
Yes, 2
Yes.
weeks after second dose, no vaccines, no flu, no shingles, nothing.
Okay.
And that goes for before the vaccine as well. You shouldn't be receiving any vaccines at least 2 weeks prior to getting your COVID vaccines.
Great, thank you. Well, first of all, I want to thank the public for tuning in. I know we had several people that were tuned in to us here, and others were watching on YouTube. This was recorded. It will be presented elsewhere. But I really want to thank Dr. Agaman and Dr. Irma. The information you provided tonight was absolutely essential, and it was just so helpful. I'm so impressed with how you presented the information. It was clear, it was concise, and really, hopefully people watching will feel more comfortable, or at least if they have a relative or a friend who's hesitant, to get them to watch this recording that we've done. Again, thank you so much. We really appreciate your time. We know you're very busy, but this is also very important. And just in closing, I would ask if, well, first of all, I want to ask if either of you have any final comments or any thoughts you'd like to share.
Just get vaccinated.
Oh, Mayor, I forgot to share with the public that as their Chief of Community Services, I got my first vaccine and I'll be getting my second one. I want to make sure I have to be an example and a role model. So I got my first one and I'll be working to get the 28 days or the 27 days, whatever that is. So I want to make sure I go on record for that.
I got my first one. I became eligible in February when they dropped the age a little bit. I'm not going to tell you which one, but I got my first vaccine, and I'm scheduled for my second one on March 17th. I'm looking forward to it. I think it's so critically important. So just two other things I'd like to mention. That was mentioned earlier about check the CDC website and other professional websites with the .gov for real information. Social media can drive people crazy. It's like feeling a pain and getting on Google, and right away you've got the most severe disease that you can probably imagine, rather than going to a professional and talking. So the other thing is, in Norwalk, we heard that some places, once you pierce a vial, if you don't use the entire vaccine, it's no longer good. You have to dispose of it. We have created a wait list so that if at the end of a day, or as we're approaching the end of the day, we realize we're going to have extra doses, we call people randomly and ask them if they can come down and get the vaccine. So that's critical. Again, we want to do more of these. This is really critical, important information, and I can't thank Dr. Agaman and Dr. Irma enough. It was absolutely, I've gotten text messages saying the town hall meeting is fantastic. Thank you very much. So you guys, you did a great job. And again,
Thanks for having
thank you to the public. Thank you to our American Sign Language and Spanish interpreter and Haitian Creole interpreter, because we want to get the word out to as many people as possible. And sometimes we fail to realize that the people who perhaps are not as fluent in English as others, they don't get the information. So it's critical that we get as many people informed as possible. So again, thank you all, and thank you and good night.